I know that as our case numbers increase, concerns may increase as well. And I want to emphasize what you've heard from Governor Reynolds, that in part, most of our new cases were identified through a targeted investigation by our local and state public health disease detectives, which is exactly why we do this work. And I want to take a few moments today to describe for you a bit more about that work and what that means. So our disease detectives follow up on a variety of conditions with public health importance, and we do this with two goals in mind. One is that whenever possible, we want to try and understand how someone has become sick. But the second, and in some ways more important reason we do this, is because we want to identify whether there are any other people in the public who would need to know anything to help protect their health. We refer to this as implementing public health control measures, and so that can mean a variety of things depending on the illness we're talking about. Sometimes that means offering a medication or a vaccine, and when those tools aren't available, we have other public health tools, which are things like advising people to stay home and providing support by having public health monitor to help these people keep track of their symptoms and how they're doing. So we also want to emphasize, when we recognize these kinds of illnesses, some of the advice that we give is to stay home, and that's really important because the more things we can do to reduce personal interactions, especially as you heard from the governor with people in those high-risk groups, the better.